So you guys, I am on my way, to get the Fraxel laser procedure done. I am mainly doing it to shrink my pores and just to smooth out the surface of my skin. So this is a close-up on my skin. Scary. But you can see like the texture and the pores. And like up here, I had my hat on, so that's not a wrinkle. That's just like from the hat, but you can see definitely a little, just like a lot of texture in the skin. And any like discoloration. They told me to eat a big meal before I go, so I'm getting ready to go to Veggie Girl to get a big meal to eat, and then I'm going in an hour and a half early to put numbing cream all over my face and to take, I think they're gonna be Valium, Norco, and maybe some antibiotics, I'm not sure. But I just wanted to show you guys my before, what my skin looks like, and we'll see what I look like when I get out.
Hi, I'm Dr. Karyn Grossman, and I am a board-certified dermatologist with offices both in Santa Monica, California, as well as New York, New York. I have over 20 years experience in dealing with lasers and was actually involved in a lot of the research to develop a lot of these laser systems. The Fraxel laser is a great system because it has lots of different versatility with it. It works by drilling little holes into the skin and leaving normal skin in between those holes. That allows the skin to heal in more quickly. The best thing about Fraxel is that it can be fine-tuned. So you can do a light Fraxel or you can do a heavier Fraxel. If you want to do a light Fraxel, you would want to be treating some fine lines or texture or just brightening your skin, some pigmentation. A more aggressive Fraxel laser will help with pores, deeper lines, and acne scars. Obviously, the more aggressive, the more downtime. Unfortunately, Fraxel isn't a one-time procedure because we are treating only part of the skin and leaving normal skin in between. You do need to do the procedure a few times to get the best results, but you will see some results with each procedure that you do. So what I tell patients is that you may need 2 or 3, or maybe even 5 if you have really bad acne scars, and then you may need to maintain them about once a year to keep your results up. For the most part, the procedure is pretty easy. We bring you into the office, we put numbing cream on, we give you some medication, and then we let you sit for about an hour and a half, so always bring something to do. After that, we clean off the numbing cream, and we do the treatment itself. It feels, well, I think it feels like a whole bunch of teeny hot little spiders running across your skin with hot legs. And most of my patients agree with me. That's pretty much what they say it feels like too. It is a little uncomfortable, but once the procedure is done, there is no more discomfort. Your face will feel hot for a little bit. We give you a cooler to use afterwards to help cool it down, and by the time you go home, you should feel fine. Depending on the intensity of the laser that you're going to have, you may have some redness that lasts for that day and wake up in the morning with a little sandpapery feeling to your skin, which will go away over about 3 days. Or you may still be a little red the next day and have some swelling, and that swelling and redness will usually go away within a day, and then it will then take about 4 to 7 days for that sandpapery feeling to go away. And for some people, if they have a lot of pigment in their skin, those little sandpaper dots will also be a little darker. So it'll look like they have thousands of little tiny little pinpoint brown dots on their skin that will flake off. People love Fraxel laser because it's pretty easy to do. You get great results with it, and it's not particularly painful. Yes, it does hurt some, but there is no reason we can't control that pain with the appropriate numbing and medications.
So right now I'm in the office. I just put numbing cream all over my face, and after an hour and a half of having this on, we are going to start the Fraxel laser.
Getting a shot right now in your butt. How's that feel?
Feels like a Charlie horse.
Pretty much. She says if she's that nervous, then give her the she took the Norco? Yeah.
I took the Norco.
Okay.
So I've had the numbing cream on for about a little over an hour, and they gave me a shot of Toradol. Was it Toradol? And I took some medication to relax me and also for pain. So now I'm just waiting for the doctor to come in and start taking the numbing cream off, and then this is the Fraxel laser machine. That's the tip there, and then that's just for setting up.
Okay, I'm just going to take the ceramic off and the numbing. This is just cleaning you off. There won't be anything surprising, nothing sharp or painful or anything that's going to be coming your way without your knowledge.
Okay.
So the next thing I'm going to do is I'm going to measure your face.
Okay.
You're just going to feel the laser rolling over you, but nothing's going to hurt. And then across. For pores, we want to be a little more aggressive to get better results. So next I'm just going to put the little eye shields over you. Okay. Now during this I'm also going to be blowing cold air. I'm just going to move your hair here, and again, like I said, there aren't going to be any surprises. I'm going to put some cold air there, and then we're going to start. You ready?
Okay.
So it kind of feels Halloween, so it's kind of apropos. I say it feels like hundreds of little tiny spiders running across your face with really hot legs. Is that what it feels like to you? Okay. Breathe. Okay, you ready?
Yes.
So I'm going to start over here, going up and down again. Okay, breathe. Now I'm going to do across the way we did on the other side. You remember?
Yeah.
Okay, take some deep breaths. Now I'm going to start on your forehead. You ready? Now, for some people, the forehead's a little more sensitive. You hanging in there? As bad as tattoo removal?
No.
Good. The forehead's a little worse than the cheeks, right?
Yeah.
Okay. Breathe. Okay.
You're making me beautiful.
We are going to give you smoother skin. Now roll your lips under for me. Yeah, and I'm going to get up across now, going in this direction. Okay. Now chin up for me some. Roll your lips under because I'm going to come up through here. Are you ready? Your biggest pores are right through here.
Yeah.
So I'm going to do a little bit more just in that area. Sorry, nose is tough. Okay, breathe. Now I'm going to have you take your left hand.
Okay.
I'm going to have you pull this down a little so I can get right behind there. One teeny little bit just in this center part of the forehead, then we're done. Okay? like, I like that word.
Yes.
Good, we're done.
Thank you so much. Okay, you guys, so the Fraxel laser is done. It really didn't take that long at all. And then they put some cooling gel on my skin because it does feel pretty hot afterwards. And then this is just cold air that's flowing, and it makes it really nice and a lot more comfortable to have this cold air on your skin. It feels really good. I'm just doing this for about 20 minutes, and then after 20 minutes they say the burning should subside quite a bit. Okay, you guys, so I just got the Fraxel laser done. It was not as bad as I thought it was going to be. Dr. Karyn Grossman's my doctor. She's amazing. She made me feel very comfortable. And I'm just going to let her tell you guys a little bit about what the Fraxel laser is and what it does for our skin.
So the Fraxel laser that we use today puts little tiny holes in the skin and leaves some normal skin in between. And that allows the laser to actually heal more quickly than the lasers that we developed a long time ago. In Shannon's case, what we really wanted to do is work on the pores and texture in her skin so that she will have a smoother, more even skin afterwards. So we did a little stronger laser on her. So I would anticipate that tomorrow she may have some redness and some swelling, and then that will go away over the next probably about 5 days. The other thing that's going to happen tomorrow is when you wake up, your skin's going to feel kind of sandpapery, and you may see teeny tiny little dots on your skin. You don't have a lot of pigment, so you probably won't see that. Because you have large pores, I'm giving you special instructions on the possibility that you may break out with a little bit of acne.
Right.
So you need to use some topical antibiotics as well as to do some soaks.
Okay.
You will see good improvement in your pores with this one treatment, but you can even do 1 or 2 more to get even more improvement, and you're probably going to have to maintain it about once a year to help keep it looking good. You can also use Fraxel to treat acne scars, brown spots, fine lines. You can also use it just to brighten your skin.
I was really nervous because I didn't really know what to expect, and I just heard, around that it's really painful, but it really wasn't. And I think if you have a really good doctor, it makes you feel comfortable, that it's really not that bad at all.
And this is what you look like afterwards.
Yeah.
She looks maybe like she did an aggressive mask that she had a little reaction to.
Yeah. How long do you think it takes to see the actual results once you're completely healed?
Well, in your particular case, one of the things that we're doing is relying on collagen stimulation from this procedure. So you will get some improvement immediately after, but it takes 6 to 8 weeks for more of that collagen to grow. So you will actually see more towards your final results for this particular treatment at about 8 weeks.
Okay.
Maybe 12 for some people.
Okay, so here is what my skin looks like. This is about an hour after the laser was performed. Does not look that bad at all, in my opinion. A little red. It feels just like a little sunburn. It's not painful at all. And I'm getting ready to head home.